So let's begin looking at the bones, what we would call the vertebrae, as well as the bones that would make up the thoracic cage and the pelvis. And so we'll start by looking at the bones that will make up the vertebrae or the vertebral column. And we start with the cervical vertebrae, which will be CV1 through CV7. The thoracic vertebrae, or TV1 through TV12. The lumbar vertebrae, LV1 through LV5. And then we have two sets of fused vertebrae, the sacrum and the coccygeal. Within the vertebrae, we do not have specific names for the bones, with the exception of CV1, the atlas, and CV2, the axis. All other vertebrae are indicated by the type of vertebrae, cervical, thoracic, lumbar, and then the number that they happen to be within that region. You can use the abbreviations CV to indicate cervical vertebrae, TV to indicate thoracic vertebrae, LV to indicate lumbar vertebrae. Along with the indicated vertebrae in terms of their regionality and numbering and naming principles, the other thing we have to deal with is the biomechanics that we see within the vertebral column. In this case here, we have two distinct curves that develop. What's referred to as the primary curve, or the kyphotic curve, or kyphosis curve, which develops during fetal development. This is the primary curve. And then we have the secondary curve, which is the lordosis or lordotic curvature that will take place. The kyphosis curve is a forward-facing curvature. The lordosis curve is a backwards-facing curvature. The curvatures allow us to stand in an erect bipedal posture. If we have excessive curvatures, we will refer to them as hyper. If we have reduced curvature, we refer to them as being hypo. Most individuals nowadays have a slightly exaggerated kyphotic curve due to body posturing as relates to sitting and a reduced lordotic curve at times. We'll get more into the curvatures as we look at the specific biomechanics of motion. But let's go ahead and take a look at the individual vertebrae and vertebral landmarks here. And we'll start with the cervical vertebrae. The cervical vertebrae have the smallest bone mass, and this has to do with the fact that they have the least amount of load being placed on them. And we'll start with the most prominent of the landmarks, and that would be the body. Just posterior to the body, we have the vertebral foramen. The vertebral foramen is going to be the opening with the bone that will allow for the spinal cord to pass through. Connecting the body to the rest of the structures will be the pedicle. The pedicle will connect with the lamina. The body, pedicle, and lamina is what forms the bony architecture of the vertebral foramen. Lateral to the lamina and the pedicle, we have the transverse process. Posterior to the lamina, we have the spinous process. Note for the cervical vertebrae, there is a bifurcation within the spinous process. This allows for ligamentum nuchae to pass along and connect the occiput of the occipital bones to the ligaments that support the vertebrae. We then have connecting bony landmarks, the facets. If they are on the superior edge of the bone, they will be the superior facet. If they are on the inferior edge of the bone, they will be the inferior facet. On the inferior aspect of the transverse process, we have what's referred to as the intervertebral arch. The intervertebral arch is what's going to allow the spinal nerves to exit the spinal cord and head to the periphery of the body. Within the cervical vertebrae, and only in the cervical vertebrae, we will see a foramen in the transverse process. This is the transverse foramen. This foramen is what's going to allow for the uh, vertebral artery and vertebral vein to traverse. This is the foramen that you have to be worried about with uncontrolled traction or cervical motion, and one of the reasons why I highly disrecommend use of any type of chiropractic service. We then get to the thoracic vertebrae. Notice the thoracic vertebrae are going to be slightly larger. Notice that there is a change in the spinal process that we see here. So we start with, once again, the body. Posterior to the body, we get the vertebral foramen. Connecting the body to the posterior aspects of the bones, we have the pedicle. The pedicle will connect with the lamina. The body, pedicle, and lamina, once again, will be forming the vertebral foramen. To the lateral aspect of the junction of the pedicle and lamina, we once again have the transverse process. Notice the spinous process and the transverse process are much more robust. And once again, this goes hand in hand with the fact that bones will become larger when we start having more things attached to them and where they have to withstand excessive amounts of physical force. We then have the facets. Once again, if it's on the superior aspect, it is the superior facet. If it's on the inferior aspect, it'll be the inferior facet. But that's not the only type of facets that we have on the thoracic vertebrae. The thoracic vertebrae will be articulating with the costal bones, and so we will also be seeing some costal facets. In between the costal facets and the inferior facet, we will see the intervertebral arch, just like we saw with the cervical vertebrae, but the cervical vertebrae do not have these last two facets, which are the costal facets. We have the superior and inferior costal facets, which will take us to the lumbar vertebrae. And the lumbar vertebrae will be the largest of the vertebrae because they have the greatest amount of load being placed on them. They will also have the most robust spinal and transverse process because they have the largest amount of physical force being placed on them, and they must have the greatest amount of strength. Once again, we'll start with the body. Posterior to the body, we'll have the vertebral foramen. Notice how the vertebral foramen has gotten smaller relative to the remainder of the bone as we move inferiorly through the vertebral column. Connecting the posterior aspects of the bone to the body would be the pedicle and the lamina. And remember, just like we saw before, the body, pedicle, and lamina will be forming the bony components of the vertebral foramen. Lateral to the pedicle and lamina, we will have the transverse process. Posterior to that, we will have the spinous process. And just like before, we've had the superior and inferior facets. Now notice that the superior and inferior facets within each of the vertebral bones are changed their angulation. The facets are going to align themselves in such a way that the bones can overlap on each other and minimize the amount of muscular force that is necessary to maintain the kyphosis curve or lordosis curve that we see within the vertebral column. Just as before, we will see the intervertebral arch. That intervertebral arch will once again allow for the passage of the spinal nerves to traverse into the periphery.